Welcome to our channel. In today's video, we will be discussing an important supplement that is widely prescribed for nerve health, blood formation, and overall energy, and that is the vitamin B12 injection. Let us first understand what vitamin B12 is. Vitamin B12, also called cobalamin, is an essential vitamin that plays a vital role in the production of red blood cells, maintaining healthy nerves, and synthesizing DNA. Our body cannot produce vitamin B12 on its own, so we must obtain it from food or supplements. Foods rich in vitamin B12 include meat, fish, eggs, and dairy products. Now, let's see why vitamin B12 injections are prescribed. Doctors usually prescribe them in conditions such as vitamin B12 deficiency, pernicious anemia, which is a condition where the body cannot absorb B12 from the stomach, megaloblastic anemia, a blood disorder caused by lack of B12, neuropathy, or nerve damage, especially in diabetic patients, tiredness, weakness, and fatigue caused by low B12 levels. Sometimes they are also used in patients after stomach surgery or in those with malabsorption problems such as celiac disease or Crohn's disease. Now let's understand how vitamin B12 injection works. The injection directly supplies vitamin B12 into the bloodstream. This bypasses the stomach and intestines, which is very helpful in patients who cannot absorb B12 from food or tablets. Once in the blood, vitamin B12 helps in the proper formation of red blood cells, boosts energy levels, supports nerve function, and improves mental clarity. The dosage of vitamin B12 injection depends on the severity of the deficiency. In severe deficiency, doctors may prescribe injections daily or weekly at first. After improvement, the injections may be given once a month for maintenance. It is usually injected intramuscularly in the arm or thigh by a doctor or nurse. Now let's discuss the benefits of vitamin B12 injection. It treats and prevents anemia, improves nerve health and reduces numbness, tingling or burning sensations, boosts energy levels and reduces fatigue, improves memory, mood and concentration, supports healthy hair, skin and nails, helps in overall growth and development. Like all medicines, vitamin B12 injections can also cause some side effects, though they are generally safe. Common side effects may include pain, redness, or swelling at the injection site, mild diarrhea, headache, dizziness. In very rare cases, serious allergic reactions may occur, such as rash, itching, swelling of face or throat, difficulty in breathing, fast heartbeat. If any severe reaction occurs, immediate medical attention is required. Now let's move on to some important precautions. Vitamin B12 injections should only be used on a doctor's advice. Patients with Leber's disease, a rare eye disorder, should avoid B12 as it may worsen vision loss. Patients with kidney or liver problems should inform their doctor before using this injection. Pregnant and breastfeeding women should only use it if prescribed by a healthcare professional. Regular blood tests may be needed to check vitamin B12 levels and response to treatment. To summarize, vitamin B12 injection is a safe and effective treatment for B12 deficiency, anemia, and nerve related problems. It boosts energy, improves brain function, and maintains healthy red blood cells. It is especially useful in people who cannot absorb vitamin B12 through food or oral supplements. If you found this video helpful, don't forget to like, share, and subscribe to our channel for more informative videos about medicines and healthcare.